Hi everyone, I'm Mia. Welcome to Making Science Work for Social Justice, a workshop brought to you by the Truth School and Western Mass Science for the People. So the goals for our workshop are to explore solidarity science. And so what does that mean for our communities? How do we create coalitions? How do we listen to each other better? How do we critique the role of science in our lives? And rather than ask, how do we fix this? How do we begin to ask, who do we need to fix these issues? So throughout this workshop, we will present a few examples that illustrate solidarity science and how it can solve issues, and how working with social, political, and economic and cultural contexts can help solve these issues in a better way than previously. And so we'll present these examples, and afterwards we will break into groups and use solidarity science to address issues we identify in our communities. And then we will share back what we've learned throughout these breakout groups. So now I'll hand this off to introduce the rest of the people from Western Mass Science for the People who are helping facilitate this.
Hi, my name is Sigrid Schmalzer. I'm a professor at the University of Massachusetts Amherst in the history department. My focus is on the history of science in socialist era China and also the global history of science activism. And I'm just going to tell you a little bit about the organization Science for the People, and then we'll hear more from other chapter members here in Western Mass. So Science for the People emerged in the late 1960s out of the anti-war movement. A bunch of scientists and engineers who were fed up with having their research go to further US imperialism and militarism instead of addressing social needs and furthering social justice. The organization lasted until 1989, and over the course of those 2 decades, it was really a leading voice in this country, offering an anti-capitalist, anti-imperialist, anti-racist, and anti-patriarchal analysis of science. The members of the original organization, of whom we have some on this call, I'm very happy to see people, have gone on to do a lot of important work in many different fields, including occupational health and safety, agroecology, engineering for social justice and peace, many different fields. And the organization itself has been revitalized in recent years, especially following the Trump election. And it's been revitalized not just to defend science, which is something that a lot of liberal organizations are working on, but to analyze the workings of power in science and to explicitly stand in solidarity with marginalized communities and fight for science that works for social justice. The magazine, which was a major contribution of the original organization, is also back, and you can find it at magazine.scienceforthepeople.org. And there are chapters now in many parts of the United States, including here in Western Massachusetts. So now if the other members of the Western Mass chapter who are helping to facilitate this want to just briefly introduce themselves, that'll complete the introductions portion. I think Andrew's up.
All right, hi, I gave a really brief introduction earlier, but I am Andrew Cunningham with Science for the People. My background specifically is in computer science, and like a lot of the movements I've been a part of are trying to create more ethical and social justice oriented opportunities for work.
Brian?
Who's next?
I think Brian.
Okay, I'm Brian Schultz. I'm a faculty unit at Hampshire College. I work in agriculture, ecology, and statistics, and was an old fossil from the original Science for the People in the 80s, too.
Hey everyone, my name is Emma Harnish. I am a proud member of the Western Mass Science for the People chapter, and I graduated from Smith. I got a degree in geology and am now very passionately trying to figure out how to incorporate social justice concepts into the geosciences and environmental science classroom, along with another one of our members, Mia.
Lynn?
Hi, everyone. I'm Lynn Watts. I'm a grad student at UMass Amherst. I study geosciences, and I will be answering all of your questions via chat during this.
And then Lynn and Mia have also already spoken, but did you want to say anything else to introduce yourselves, or?
I'll say I'm a student at Smith College. This is Mia again. And like Emma said, I'm working to integrate social justice perspectives in environmental science curriculum. Specifically, I focus on traditional ecological knowledge and including Indigenous perspectives into the climate change narrative from an insider's perspective, not from the out in, so from the bottom up approach to things.
And I'm Steve Fernandez. I am at the College of Engineering at UMass Amherst, where I am very interested in social justice engineering. In addition to working with Science for the People, I'm also with Engineering, Social Justice, and Peace. And I thought I saw Caroline Bailey, who's one of the founders of the group, here as well. And my focus is on social justice engineering and also on fostering community collaborations.
And Tatiana? I know Tatiana's there. I saw her.
Good afternoon. I'm Tatiana, the community activist. I'm a member of Science of the People, and I work closely with Arise Social Justice to be the Mole Lady of Springfield.
Great. Okay, I think we're moving into the, unless I've forgotten anything, we're moving into the overview of solidarity science concepts. So I'm just going to talk for a few minutes about that, kick off this section of the workshop. So this is a few concepts that inform the work of the Western Mass chapter of Science for the People. The overarching concept that we'll be talking about is this concept of solidarity science. And this is the notion that scientists, engineers, and other STEM workers should not just be working for the people in a top-down way as if bestowing charity, but working with the people, recognizing the knowledge that community members hold and ensuring that community priorities and perspectives are there from the get-go as we collectively develop robust scientific knowledge that addresses social needs and furthers social justice. So our understanding of solidarity science rests on two other concepts developed by scholars, including especially feminist philosophers of science, Donna Haraway and Sandra Harding. And these are the concepts of situated knowledge and strong objectivity. So in a nutshell, situated knowledge recognizes that everyone has knowledge and that everyone's knowledge comes from somewhere, and it relates to specific social, political, and economic situations. So this is as true of lab scientists as it is of farmers. It's as true of doctors as it is of patients. All of these people have valuable knowledge to contribute, and each person's knowledge relates to where they sit with respect to the rest of the world. And then strong objectivity is the idea that our collective understanding of the world is more robust if it involves a greater diversity of observers. So because all knowledge is partial, we're going to know things better if we bring more people to the table when each of us is examining the phenomenon from our own social location, each of us contributing our own situated knowledge. And then we create this knowledge collectively from all of those different perspectives. So the next several speakers are going to address specific points that help to explore these themes more fully. And then along the way, you're going to be treated to excerpts from a comic called Science Under the Scope, which was written and illustrated by Sophie Wong. The full comic is available on the website freerads.org. This is the organization Free Radicals, a group of kindred spirits whose work is very much appreciated by Science for the People. So maybe turn to the next slide and we'll turn it over to Brian.
Is the slide up? I don't see it.
It's up.
Okay, I don't see it, but I'll just go ahead anyway. So I'm a scientist as a science for the people type, so I tend to think that I find myself saying to classes often, one of my jobs as a scientist is to defend science and make it to see why it's useful, but also one of my responsibilities is to point out when science stops being important and other things like social change and policy are important. So we need policy people. So for example, in agriculture, is it true that organic food's too expensive, or is it that people need higher wages? And so that's what we need, a policy change, not a science change. In terms of our actual knowledge, I find myself often talking to people like farmers, especially this is true. I have some general ideas. Science is good at knowing general things, but they know the local conditions. And so I might have an idea and they know why it's not going to work on their farm. And this is part of the point of agroecology, is not to just go beyond organic agriculture and look for more ecological solutions, but also to look at local knowledge and take advantage of real collaboration with farmers and know what they're doing on their farm more than we do. And in terms of questions, you tend to find that as a scientist, what questions do you ask? It depends a lot on who you hang out with. If you work for a chemical company, you're going to work for things that help your chemical company. If you hang out with farm workers, you're going to tend to want to do things that help farm workers. So that's why it's true that if you want to do science with the people, you should do science with the people. That's it.
Hi again. So another concept to bring along is that people with less power in society are often assumed to be without relevant knowledge. So in our society, those with money have knowledge that is prioritized over those who don't have money, or those with academic degrees. The higher your degree, the more knowledge, the more expertise, and the more worthy you are of being heard. I find this to be the case in my own work, studying traditional ecological knowledge, which is knowledge of indigenous people's knowledge of the land. That knowledge is seen as less valued in our society than Western science, even though traditional ecological knowledge has existed for longer than Western science and brings to the table another set of perspectives. And so if we want to practice solidarity science, we have to work to understand and give all knowledge the same value, and understand that every individual and every different type of knowledge brings something to the table, that we need to understand things holistically.
So as scientists and engineers, the traditional approach to training is that we specialize in a particular branch of our science or engineering. And when we need to solve problems, the way we're trained to do that is to go to our labs, shut doors, turn on our computers, and come up with problems. Come up with solutions to problems. Our motivating factors, if we're in the private sector, are money. And if we're in academia, it may be to publish papers or to get more funding. When the solutions don't work and it doesn't fit with the community, well, we often blame the community for not understanding the technology or not being able to use it well. On the contrary, for solidarity science, we have a different paradigm and a different approach, which is to engage community. And for example, I am trying to establish a collaboration with the Compost Cooperative. If I was to go the traditional approach to solving engineering problems, I may say, all right, here's what you need to do. You need to expand into affluent communities, and to work more effectively, why don't you go out and collect the compost at a time when there aren't many people on the street, late at night, and that way there won't be so much traffic. We get things done faster. And if I engage with community, I'm more likely to hear from people in the community, in the compost cooperative, that a lot of their members being recently incarcerated, that may subject them to being targeted by police. So by practicing community-based science, solidarity science, we come up with approaches that better fit the needs of the community. Our motivating factors aren't money or publishing papers, but the needs of the community. And generally, the solutions that we come up with are more sustainable, have a better impact on the environment, and fit the needs of the community better.
So what happens when we don't include them on these decisions? Steve touched on it a bit with just missing those perspectives, losing out on the idea that people might be targeted by police when you don't have that perspective. And this is a really high spanning problem. I'm in computer science, so I see a lot in Silicon Valley. There's a big disruption culture where people want to make these apps that fundamentally change society, but usually it's just a bunch of app developers that make them. So to incite sort of a case study example, we have Airbnb that set out with this idea of changing how hospitality works entirely. And we've seen as time goes on that the effect of Airbnbs in urban areas, it has really accelerated the rate of gentrification. So we're seeing short-term rentals going up. In some cases, very extreme cases, we're seeing evictions to convert housing to Airbnbs. And this is spanning far beyond just that one case study, but that's the kind of issue that can happen when you leave out perspectives and you don't complete your circle, as the diagram would show. You get your biased solution, and you do not get a solution that serves the people.
So, what do we get when we all come together and share our expertise and knowledge to inform our struggle for justice? Solidarity science. That is what we consider solidarity science. The slides that you just saw, the people that you just heard from are practicing this concept. And you may be wondering how you actually enact solidarity science. So we approach science through a lens that acknowledges the intersections of power. We actively seek to change the ways we interact with scientific methodology and unlearn its top-down approach by inviting the voices that have been pushed out to the table. Western Mass Science for the People focuses on STEM education and reimagining and rewriting curriculum. Mia and I have co-taught classes in introductory environmental science and geosciences classes that address overlapping environmental science concepts and social justice. And we also work with grassroots community organizers to leverage the power and authority that society gives science and technology, and listen to the incredible research our community is doing. You'll soon hear from Tatiana Cheeks, organizer with Arise for Social Justice and head of the Mold Action Committee, who we partner with to understand the respiratory health impacts of mold and the environmental contaminants found in housing. This, in essence, is solidarity science.
Okay, so before turning it over to Tatiana, I'm just going to give a little bit of an overview of the mold issue. And this is going to help us think in still more specific terms about situated knowledge, strong objectivity, and solidarity science. The mold issue is one that we've been working on a lot in the Western Mass chapter of Science for the People, in a supportive role to Tatiana's Mold Action Committee that she works on through Arise for Social Justice in Springfield, Mass. So mold is a natural part of our environment, but depending on the type and the quantity, it can produce serious health consequences, including asthma and other respiratory illnesses. Also, the health consequences are more severe for people with mold allergies and or compromised immune systems. And it also, it very much intersects with economic and racial injustices. Low-income people are especially likely to experience poorly maintained housing and school environments, and this exposure contributes to much higher rates of asthma and other respiratory illnesses for low-income people and people of color. I'll also note that in the New York Times today, there happened to be an article specifically linking indoor air quality and different levels of response, different experiences with coronavirus. So people who are, and they specifically talked about mold contamination. So people who are living in housing that has a lot of mold in it, their lungs are already experiencing the effects of the mold, and they are therefore going to experience more severe symptoms when it comes, if and when they contract coronavirus. So it's very much a timely issue. So health professionals are increasingly recognizing the problems that mold presents, but many states still lack adequate policies to ensure healthy environments free from dangerous levels of mold. So here in Massachusetts, communities have been organizing to support changes to the state sanitary code and other measures that are meant to address this health threat. So as Emma was saying, members of Arise for Social Justice and members of Science for the People are a part of this effort, very much following the lead of Tatiana Cheeks. Can I see the next slide? Thanks. So tying this back to the concepts of situated knowledge and strong objectivity, we understand knowledge about mold and health to encompass not only the biology of the mold organism or the biology of human health, but also knowledge of housing, knowledge of law, knowledge of racism, knowledge of economic injustice, and many other phenomena. And that's why it's essential that the leaders in this struggle really come from community organizing backgrounds, in addition to coming from public health backgrounds. For this reason, we need many kinds of experts, and we need to consult those experts as we organize around this issue. So we don't just need lab scientists. We do need lab scientists, but we also need housing law experts, community organizers, doctors, and people living with mold. If you go to the next slide now, Tatiana Cheeks is known as the Mold Lady. She is a community expert, and her expertise comes from her experience living with mold in her Springfield apartments, caring for her son who has a mold allergy, fighting her landlord to address the mold issue, working with lawyers and judges in housing court, educating community members about the mold issue, and working with multiple activist organizations. So we can see how this concept of situated knowledge applies here. As in so many other cases of environmental justice, some of the most important voices on the mold issue are the voices of mothers who are living and caring for their families in contaminated environments. And I want to highlight here, we could actually be more inclusive and say that these are parents or caregivers rather than using that gendered term mother. But I think it's also important to see the way the identity of motherhood is socially constructed and the political significance that motherhood carries in our dominant society. So being mothers makes us see and know things in certain ways. It also makes us seen and known by society in certain ways. So being mothers gives us a certain kind of authority, but it can also really box us in and prevent people from taking us seriously. So that's a kind of double-edged sword there. Now, in addition to motherhood, of course, race, class, urban identity versus rural identity, many other factors further shape what we know, how we can use that knowledge, and then also how we're seen as either knowledgeable or not knowledgeable by others. So without further ado, and I think we're going to leave this slide up or turn it over to Tatiana, but I'm going to turn it over now to Tatiana Cheeks, aka the Mold Lady.
Good afternoon, everybody. Again, hi, I'm Tatiana. So my story started basically about 5 years ago after I gave birth to my son. I always wanted to take pictures of him, and we noticed that his nose was always running, and it was always running. So eventually, from monitoring it, I started to realize that he was much better when I took him out of the home than he was in the home. And so I didn't know exactly what was going on still, but then finally, the mold started to grow on my bathroom ceiling, because it is a fact that, like, some people with mold allergies can be so sensitive that they can pick up wall that's growing behind the wall that you can't see, but it's there and they can pick it up. So, and this is what was happening to my son. He was picking up the mold, and it was causing him to have allergic reactions. So I'm in one apartment, and I complained to them. I filed a report about the mold, and they basically come and do everything that I had read they shouldn't have done. Wipe, wipe the walls, cut the mold out, and then repaint it. And everything I had read said that was not the right thing to do. And being the fact that I knew the maintenance workers, I knew that they would not. They didn't know what they were doing. They didn't come to clean the mold with the proper gear on. They didn't have the right applying tools for dog. It's just like they were very inadequate. So I went to the housing manager to talk to her about that and to say that I have enough information to present my case the way I needed to, because I was under the impression by the time I went to court, I had letters from my son's doctor saying he had a mold allergy. And so, I was just basically thinking like they're gonna do the right thing because it's the right thing to do. So I didn't go to court equipped for a battle because I didn't think it was gonna be one. So so I was evicted from that apartment, which led to me being homeless for about 13 months, bouncing around from different hotels to hotels. And now I'm realizing that it's mold in the hotels. It's mold in, like once you realize mold, and after I did all of this research and I'm studying this because it's affecting my children, because throughout the process I also found out my daughter has a mold allergy.
Hey, Tatiana, you're cutting out. Can you start again from when you were explaining that Kayla has a mold allergy?
Yes, mold allergy, I'm sorry.
Okay.
Even though he see his sister and brother suffer it, he still did not become a believer. And so with that, just realizing that it was a bigger situation that I didn't know what to do with, I went to Arise for Social Justice to talk to them and see what can happen. And one of the workers at the time, Tavar, told me I should take the course to Science of the People. And so then, so I met with Science of the People, and we started this wonderful relationship that's still continuing 4 years later. And we have been doing work, and I have been doing more research and more research. And so finally, after a year of being homeless, I got my own apartment, and hey, everything is great and going fine. And my neighbors flood the basement. And at the time, they told me they had a flood in their basement. I didn't realize that the water was going to go into my basement, and so it might have been about 10 to 14 days before I had actually went in my own basement and to find like a pool of water in my basement. And so my landlord came, he had the water suction out, but he didn't take any other measures to make sure we didn't receive a mold problem. But considering that the water had already been in my basement for 2 weeks, the mold problem had already set in. And so we was going, and then we finally see the mold. I start to see the mold growing in the house, because at first it was like in the basement, and I was actually having conversations with him about the mold in the basement, and they were really going nowhere. So it was just like, okay, this is just the basement. I kept my son and my daughter from the basement, and that's how we worked the situation out. But it eventually started to come into the house, and my son just started to be sick all the time. And everything was his mold allergy. Like every doctor, every report, from his allergist to his primary care provider, that's it. All was saying that the only thing was wrong with him is that my son was allergic to mold, and because mold was in the home, we needed to have it remediated. So I took this back to my landlord, and at this point, I actually had a mold remediation specialist come into my home and prove that I had mold growing in my home. And so he was like, yes, and like he gave me a proper a bill, like saying what needed to be done and everything with my landlord. And I gave my landlord, and because it was, I don't, in the grand scheme of things, I don't think $2,000 is a lot of money because this is my son's health, but the bill was like $2,000. So my landlord took it upon himself to contract a air quality specialist, and the air quality specialist recommended I put an ozone oxidation machine in my home to kill the mold instead of doing remediation for a much cheaper price.
Tatiana, you cut off again.
Then I ran across an expert, and I was having conversations with him, and I told him about the box in my house, and he explained to me that it was an ozone oxidator, and I needed to immediately stop using that box because it was making me sick. Fortunately, at this time, my family, because it gave off an awful smell, I didn't. I only used it when my family was out of the house and when I was home, so it started to make me very sick. But I didn't understand until after having this conversation. So now, again, I contact my landlord with the mold expert, and it's, we're
Tatiana, are you there?
in documentation of it.
There you are.
The judge is saying that I am not an expert, and because the mold quality person was an expert, he took his expertise over mine, even though for $75 I could have the same qualifications as the mold expert because that's how much it costs to get qualification. So we are fighting back and forth in court. And Science of the People, it was really going bad in court. The judge was just dismissing me because my landlord had his fancy lawyer. They had the mold expert, and everybody was coming in all fancy, and I'm being dismissed. Nobody's listening. And then one day, Science of the People and members from Arise came to court, and it was a shift in the case. The judge actually started to listen and to look at more of my documentations. And in this process, I'm discovering more and more things wrong with my apartment. So eventually it ends up with my landlord just paying me to move out, which is not really what I wanted because that didn't solve the problem, because a month later he had another family in there with kids and he didn't have to disclose to them that this apartment had a mold problem. And so this is why, even though my case was over and I moved into a new apartment that is completely mold free, thank you, no mold, but I still continue the journey of bringing awareness throughout the community and trying to help the community because since being with Science of the People, we have tried to get policy changed and attended multiple meetings to help change the policy. But that whole process has me so frustrated because it's very long for no reason. They don't really want to share, they don't want to share the process to let the people know what's going on. So right now, even though Emma or Sid, can y'all help me with the date of the last conference we attended in Worcester? I can't, somebody tell me the date.
That was, I don't remember the exact date, but it was September, right? Or October last year. Yeah.
Last September, October, we went to a meeting about the policy changes and the wording of the policy, and last October, and Sigrid has been getting the runaround since last October about when are the updates are gonna come out and stuff. And then it's even though we did this, it's not gonna be the option they're seeing before they submit it to the public. When the public see it, it's gonna be set in stone. So any changes, then it's gonna go into another 2-year battle of going to get policy changed and all of that. When I know, because being a mold lady and being out in this community, it is multiple families suffering from mold because they have mold allergies or they have upper respiratory conditions. And we live in Springfield. We live in New England. New England has just a lot of mold by nature, because not all mold is bad, and we have to have some mold. But New England has very high counts, which we trap into our homes and creates mold problems and stuff like that. And so I have been trying to spread awareness. From some people, I get like a lot of pushback. They just don't want to listen. They can't see mold. They can't see it. They can't see the dangers of it, so they just don't want to listen. I mean, I can't justify why I'm having such a hard time trying to get people to realize how dangerous mold is when in Springfield, when they have a school that's basically been fighting for mold to get mold out of the school for like 20 years already, and but the school is still in existence, and like the mold problem hasn't been created. It's just been reported throughout in the winter that the courthouse and the city hall are mold infested and need to be cleaned, and yet they still got workers going to work in there every day. So I can't, like, because we have to wait, because my hands is tied until some type of policy or regulation is passed. I do what I can, and that's by helping my community. Like if I go to somebody's home, if somebody contacts me with questions about mold, I go out and I visit them, which is also putting myself in danger because I have been in some apartments that when I come out, the mold has made me very, very sick because the mold inside the apartment was so bad. I actually have helped in getting 2 apartments condemned because the mold and the conditions were so horrible. And so now, like, while I'm waiting for the regulations or whatever new policies they're going to put into place, it's not much I can do besides bring awareness to everybody, still keep talking about it, still going out in the community, helping families, and giving them suggestions and tips on how to best clean up the mold, how to help eliminate future mold problems, and in some severe cases, to prepare them for having to go to court. But I will say, I do think because of everything that's been going on as of late, the court is not being so quick to just dismiss mold cases. But it would be great if we could get code enforcement in Massachusetts to not dismiss mold cases, because if they was to acknowledge it, and this is how I feel if code enforcement was to acknowledge the real problem that mold is, we wouldn't have, tenants wouldn't have to end up going to court and fighting their landlords, because they could call code enforcement could step in and make sure that it's being handled properly. But right now, code enforcement rules is wipe it off the wall, paint over it, and go about your day. And that does not work for people with severe mold allergies or upper respiratory conditions. And then, like, it's so weird because that same son I told you about who was like not really caring about the mold, thinking like, okay, well, it's not bothering me, so he didn't have to worry about it, just called me last night because in his new apartment he has a mold problem, and his girlfriend is pregnant and she has an allergy to mold. So again, now he's like, oh, what can be done? And as I'm talking to you, he is blowing up my phone. It's like my phone is ringing with him calling me. And I know it's something to do about the mold in his house, because now he wants a immediate fix to the mold problem. And even with that being my own son, I know I just have to tell him honestly, like, this is not going to be an immediate fix. Go out and get you some vinegar. Go out and get an air purifier, to, things that cover up the situation and make the air better for them to live in. But it's really nothing else I can do, especially with the coronavirus now and all this, with the city being closed down. Like, mold wasn't a priority before corona. And even though I appreciate the CDC making a connection with mold and corona today, I doubt if the judges at the courthouse are going to read it before May 6th when they open back up. And also, right, the courts, like, I can't even tell them to, like, file emergency papers in the courts because the courts are closed now to May 6th. So it's like mold is very serious. And so, again, the main thing I want you to take from this, if you don't have an air purifier in your house don't go crazy and running out like a maniac, but try to get one as soon as you can.
Thank you, Tatiana. Okay. All right, so if you're like me, I have a problem sitting for a long time. So just take a minute, do a small stretch if you want.
Do I
And
have more time?
Tatiana, we're gonna move into the breakout sessions unless you had a final point.
Oh no, that's it. If there's any questions, I'm good.
Yeah, and then we'll also have time for questions so that we can all get everything that we need answered. So we're going to get into hopefully the more interactive piece of this workshop. If we were in person, this is where we would go into smaller groups and whatnot, but we are going to do this virtually, and bear with us because technology can sometimes be a headache, but we will use it to our power. So what we would love to do is have everyone move into breakout rooms. Don't worry, I will do that for you. You'll be like pushed into a breakout room so that you can discuss some scenarios and ways to apply solidarity science concepts to different community issues and different problems that we are facing together. These, you can definitely choose your own scenario, but there are some suggested scenarios if you're having a hard time thinking of something that you want to discuss with your group. I also wanted to note that I will pause the recording at this time, so none of your discussions during the breakout session will be recorded at all. They'll all be within your group. And I also wanted to make sure that if people had any big looming questions about solidarity science as a whole before you go into the breakout rooms, you're welcome to ask them now, or you can also message any one of the Science for the People hosts via chat, and we can help chat about what you're thinking.
To make sure that we can stay healthy and not fall to the coronavirus. So Science for the People has laid out demands that address some of the concerns that our workers are facing right now in the wake of this virus. And I'm just going to read those for you. We demand that all public and private healthcare institutions listen to and meet the needs of nurses and healthcare workers. We demand that these workers be given adequate pay, benefits, and protection immediately, not only during the pandemic, but permanently. We demand that healthcare and essential service workers be given proper personal protective equipment for their safety. So right now, these demands aren't being met, and that's why we have had to make them. And this is a tragedy. And the way that we have to face this is together on the grassroots. We have to start using solidarity thinking to open the dialogue on addressing our workers' concerns, form campaigns around getting them their personal protective equipment. A lot of PPE campaigns are forming. There are many, there's probably one in your local area. I know there are several in Massachusetts. We'll be providing links to those, and as well as some in some major cities. But the idea of these PPE campaigns is to get this personal protective equipment from the hands of those who have them. And these are things like goggles, masks. Like this diagram has some, but there will be more specifics in the resources that each campaign is looking for different things, or often the same things, a lot of masks. We need to get them from the hands of people who have them into the hands of people who need them. This means demanding our academic institution give their unused PPE to the hospitals that might be facing an urgent shortage of them right now. And not just having academic institutions give them to affiliated hospitals, but to give them to the hospitals that are in the most dire need at the moment. And it's a tough movement because it's not the natural way the market works, but together we can form a grassroots movement around the needs. So we'll have links in our chat to provide you with with the channels to get involved in your local movements. Next, we want to talk about epidemiology and what that means for the decarceration movement. So right now, I mean, in all cases, you're going to see that with tragedies like the coronavirus, low income and marginalized populations are going to be affected the most. So it's important that we put their needs first. We also need to recognize that incarcerated folks are a marginalized population. They are, especially in this in the wake of a virus, they are in a high risk category with no means of defense. So Science for the People has put out demands for that, for addressing the concerns of low income and marginalized populations. And we also want to talk about decarceration as a whole. So first, the demands. We demand that the needs of low income and marginalized populations are put first in public assistance programs dealing with the pandemic. And we demand that any science and technology developed to respond to the pandemic are available for all without profit or patent. So these are also things that we have fear might not be met without taking drastic action. I mean, we heard about how if there were a vaccine developed, it would be incredibly expensive and not accessible to low-income families. But in particular, talking about decarceration, this is often left out of the conversation. Prisons, as it stands, are overcrowded. There are a lot of low-income people who are just being held on bail, still awaiting trial. We're seeing a system of incarceration that's enforcing systemic oppression. And in a virus, it's also forcing people to be exposed to a highly contagious virus with a mortality rate that is real. And in the prisons, there are also lower hygiene standards and little access to healthcare. So, but in applying our solidarity framework to this, we need to figure out how we can address these concerns. We need to bring in epidemiologists to talk about disease spread and controlling it. We need to talk to legislators who are able to change the conditions, healthcare workers. We need to talk to the people who are actually being incarcerated and see what that means to them and what their fears are in this. And without that, we're gonna see a real high-scale tragedy. There are already outbreaks that are being tracked. We also have a link to, it's called COVID Behind Bars, and there's a map that is tracking current outbreaks in prisons across the United States, and actually in other countries too, I believe. And it's already started. There are prisons that have gotten COVID, and once that starts, there are very few means of social distancing. So right now, we're calling an urgent call to action for decarceration. We're calling our sheriffs, we're talking to our legislators, where this needs to happen as soon as possible before irreversible harm happens. And so we have a whole bunch of links in connecting to Western Mass movements on this. But also, if you're not from Western Mass, there are movements all over. And if there isn't one near you, try to start one. These resources can help you to sort of guide you in what it looks like to build this kind of movement. But make the calls you got to make.
Okay, so the pandemic and public response. So the final demands that our Science for the People as at large have made are for truth in reporting and accurate data about the pandemic. We demand a global and peaceful response to the pandemic. So far, I feel that our governing systems have definitely failed the people. A lack of credible information has created undue fear in an already anxious time. Lack of transparency, lack of care, lack of solid infrastructure and healthcare. This is just showing us how the state views profit over people. So this is a time to also collectivize our demands and continue to expose how these systems of oppression are interlaced with disease and their cures. With truth and accurate data, we are armed with the information to rightfully demand healthcare and housing for all, for paid sick leave, for suspending rent and debt, for decarceration. mutual aid networks, on the slide there, we've got a map of mutual aid networks here in Western Massachusetts. They've immediately grown alongside this pandemic and are helping to make sure those who haven't been given a seat at the table aren't continuing to fall through the cracks. And this is what solidarity science looks like. This is making sure that we are coming together and going through our experiences, our expertise, the resources that we have, the access that we have, and sharing it with our communities to make sure that we are all holding each other up. And that is solidarity science. This is also a global struggle, and we cannot fall for the nationalistic and xenophobic rhetoric and policies being spewed by our government systems around the world. To move through this pandemic, we must call out the political, social, economic entanglements that endanger people worldwide, and trust and share resources, research to lift each other up to move through COVID-19 safely and responsibly. So, it's a big topic, and I just want to thank you all for staying with us for this entire 2-hour workshop. I am so grateful to you all, so grateful to my comrades in Science for the People who helped design this workshop. And just want to say, if you haven't filled out the evaluation form, to please do so. And if you want more information about Science for the People, getting involved with one of our chapters, we've got many chapters across the United States and growing internationally. Please reach out, and we would be happy to connect you and get you the information and resources that you need. So we'll also send out the slides for this workshop, and then the links that Andrew was talking about earlier, and anything that you want to continue learning with us about. So at this time, I'm going to turn my mic off and let anybody else share anything that they need to say before we sign off. So thank you guys all for coming so much. Thank you.
This is MJ. I just want to really profoundly thank the trainers, leaders of this workshop. This was an extraordinary effort. We had as many as 54 people who joined us this afternoon, and the work with presenting the material, leading the breakout groups was phenomenal. So thank you.
Hi, this is Heather Craig, and I have an important piece to share that I didn't see addressed in it. I have a large number of contacts in the people who are not sheltered in Northampton, and there are 3 people who are being battered by other people who are not sheltered, and we have not been able to get restraining orders because the courts are closed. And the police have also told us even if they had one, they can't enforce it because the jail isn't taking any people. So when we're looking at decarceration, we need to get everybody out of there who is not in danger of violently hurting somebody, because we do need some space to stop people who will probably leave one of these women dead. This isn't a joke, and it's really pretty scary. So I don't know where that fits in this scenario, but it has to fit somewhere.
Yeah,
Thank you.
absolutely. Oh, sorry. Yeah, to speak on that, on the decarceration, you'll see in a lot of the movements, they talk about nonviolent offenders as well. And if you plug into your local movements, you can, like that is a really important perspective to offer. And the whole idea of solidarity science is including perspectives like that in making sure that we can keep everyone safe and serve everyone.
Yeah, if I could chime in there too, in our small group, we actually talked about COVID-19 the whole time. That was what we ended up talking about, and we emphasized this was actually raised by Tatiana, who was in my group, the need for knowledge about domestic violence and about child abuse, that this is knowledge that is essential in our struggle against COVID-19, because if we don't have that knowledge, then the very measures that we put in place are going to be measures that endanger people's lives. And while I'm talking about that too, just a couple of the other points that came up there for us were the need for mental health expertise, especially for how all the social isolation is impacting people with depression and other mental health needs. Also, cafeteria workers know about kids' nutritional needs and their and what they actually eat. So like imagine a table big enough to include cafeteria workers as well. And then Charlie Welch, who's a member of the original Science for the People and who is in our group here as well and has a lot of expertise around tech support and tech solidarity, talked about the need of Wi-Fi and the need for people actually to be in communication. And I noticed that map that you put up, Emma, there's like this big cluster of mutual aid going on in Northampton, and we saw one dot in Springfield. I don't know whether that was a RISE or who that was, but it really highlights the disparities in terms of access to the technology. Like I don't know how your community would get to be on that map, but there's probably a lot going on there with access, internet access, and so Charlie was talking about work like Wi-Fi experts getting out there and making sure that people aren't so isolated that they can't even tap into these mutual aid networks.
I just ask Heather if you could maybe type an email to us or put it in the chat, the specifics, so we could follow up on this issue. Because I don't think it's something that we could solve right now in this workshop, but we could definitely meet afterwards and try and address some of the concerns and hopefully be in contact with you. One of the concerns I have with decarceration, I guess, is that how you say decarceration? I think that there are too many people, and I'm aware of the thousands of kids who've been forcibly taken from parents who are still in child prisons, in COVID-19 centers, and it's horrible. So a lot of undocumented immigrants are in these detention centers and jails, and they pose no harm to anybody. But then decarceration is not enough, because now you let people out, they have no means possible of financially supporting themselves. They're not going to get even that $1,200, which is by no means, no stretch of the imagination, enough. And they're not even going to get that. And then you're like, hey, you're out in the street, fend for yourself. So a lot more needs to be done on a lot of aspects. So, but if you could please, Heather, we'll hopefully we'll be in touch and try and address that issue.
Yeah, and I think it's important to, this pandemic has highlighted how these systems of power and these systems at play aren't made to help people, aren't made to protect people. And, prisons aren't places of justice, in my opinion, places where people are, even if people have these orders, I feel like the criminal justice system continuously leaves domestic violence victims at risk, and there's limits to all these things. So I think it highlights how we as a society need to change and build up and reimagine justice and reimagine our new world. And hopefully this can be a start of us doing that and pushing forward that even more strongly than we were before.
I just want to thank the organizers for organizing this session, and I want to offer one hopefully inspirational example from not in the U.S. but halfway across the world, in the Indian state of Kerala. Since 1962, they have had their own Science for the People movement called the KSSP, which is the Kerala Shastra Sahitya Parishad. And even in 1996, they won the Right Livelihood Award, which is known as the Alternative Nobel. So I'll share a link in the chat about their website and some of the work that they've done. And it's a great model and very inspiring for what we hope to achieve as well.
I was just going to say that Science for the People tends to try to promote science that's not reductionist, more holistic. And so these things about nutrition and depression and how they affect the course of a disease like this should be a key part of the whole thing, or antibody testing. And then what we also try to promote is science for people, not for profit, and pointing out how government errors. And so one reason we don't have lots of respirators stored, because there's no profit in storage things unless you're planning to hoard them for speculation later. We have thousands of nukes sitting in silos waiting to be used someday, but not thousands of respirators. And there's going to be other diseases like this coming along. So profit can't be the only motive.
Any other final thoughts from anyone who would like to share?
Yeah, I just want to thank Vijay for presenting the example from Kerala. I'm aware of a lot of positive things that are happening in Kerala specifically, but in other parts of India. So I got to see this summer some of the work that's been done by Barefoot College with a lot of people around the world. And I think that we should also try and expand where we look to beyond Western Mass, beyond the United States, to the global community, because there are a lot of positive examples in other parts of the world that we need to be sharing and learning from.
Thanks so much for your comment. And I want to say in context of COVID-19, among all the places in India, Kerala was the one that even back in February actually successfully contained the spread because of their policies. So Kerala has a public health system that is actually very spread out. So people, of all ages, all socioeconomic levels have access to a very close primary care hospital. And so that way, symptoms could get treated. And they also had a very good communication network, so that the 3 cases of COVID-19 that came into the state of Kerala back when Wuhan, China declared a pandemic in that part of the world, isolation units were built in those, that network of hospitals, and essentially the pandemic was effectively contained. So we should all read kind of that case study on, in future pandemics, how Kerala was able to successfully control it.
Isn't it? I think it's still true, right? Kerala is a great example. People like to cite, while they're bashing socialism these days, it's an elected communist government, or at least it has sometimes. Kind of got the best of both worlds. You've got democracy and state power.
Yeah, so exactly. India is a democratic republic, but in state level, and this is totally through elections, the governing party in the state of Kerala is the CPI, the Communist Party of India.
Yeah, there's a lot of examples of what we could learn from Kerala. So I totally agree. I'd also like to point out the efforts by Cuba, which has sent doctors to Italy and other parts of the world. And Venezuela has, despite all their critiques and all the legitimate critiques that there are of the government, not to mention the illegitimate critiques, but they've been able to keep the COVID-19 pandemic from spreading as much as it has in other parts of Latin America.
Should think of this when next time everyone's bashing Bernie for bringing up good things about Cuba. We had Vietnam. We have bad things too. Everybody's got pros and cons. So let's learn from everybody.
Thank you all for bringing up these fantastic points. Just want to make room for anyone else who would like to share anything. I'm willing to continue having conversation. Again, don't feel like you need to stay, but anyone else would like to share a resource or something that they want to bring up, please go ahead.
I would just like to say quick back because I read a message from Nev. Nev, if you are still here. Emily, you can contact anybody from the Science of the People from my email and ask me anything that you need to ask me. Okay, thank you.
I know we have a couple of folks from Massachusetts, and so this morning, I believe it was the Department of the Interior declared that the Wampanoag tribe would lose all of its territory. So as of this morning, the tribe will be kicked off their territory. I'll send a link to the logistics, but I just thought people from Massachusetts should be aware that, you know, while there's a pandemic happening, the government is pushing through and did push through legislation that just took territory away from Indigenous people who have been here longer than most of us have.
I'll add on that because that strikes to my heart. When I was at MIT in Science for the People in the 80s, a good friend of mine was John Peters, whose son was the head spiritual leader for the Wampanoag. At that time, it was the Kennedys who was trying to get them not recognized or unrecognized, like that they weren't Indigenous people. I moved recently lived in South Jersey, where the governor of South Jersey declared that there's no Indigenous people. So the Lenape people there were not able to get the recognition. So it just brings up the continued genocide. And genocide wasn't something that happened in the past. It's present and ongoing today from the United States government against the Indigenous people. And beyond the United States, with the people who are leaving Central America, a lot of those people are Indigenous people who are being, there's acts of genocide being committed against them, which is the motivating factor for a lot of those people coming to the United States. So when they arrive in the United States, a lot of them don't even speak Spanish, they speak the native Indigenous languages. And again, just brings up, we really need to be aware of the continuing genocide against indigenous peoples around the globe.
I have a quick plug, and my name's Tim. I'm from Philadelphia, but I wanted to share how I enjoyed having old Science for the People magazines from way back, and how I'm a librarian, and so among my profession, there's this ethic of sharing, and I just want to call out, there's more libraries than McDonald's in this country, and a lot of the ideas that we're sharing have a lot of merit, wide merit, that's logical for people who haven't gotten too ingrained. Librarians are very open-minded, and I would just say lean on them, and they're looking for ways to host book clubs and meetups. And the ALA, American Library Association, has we used to have about 100,000 members. Now we have about 60. But on the topic of science, we have what's called a round table, people coming together with a concern, and the fastest growing one is the sustainabilities roundtable, where we talk about all sorts of sustainable things. And librarians, even in very conservative communities, can host events, films and such, that will just bring the ideas to the fore that even the reddest red community can't deny, what's going on in their farmland and whatnot. So I'll just say we're here. Sorry I was late, but keep up the good work. And you've got a great science, if you're in Western Mass, you got a great science librarian in your at UMass who's helping in this area. So yeah. And my bag is solar, frankly, and mobile solar units that, DIY kind of, that could set up a Wi-Fi hub in an Occupy kind of situation. So keep look out for that.
Thank you, Tim, for sharing that resource. That is an incredible point of access for everyone, and libraries really are an incredible resource that we should continue to lean on and continue to make bridges with to share this information, and are really leading the way in terms of like finding remote access for people, I would say, especially in times of social distancing. I've seen libraries continue to help with their ebook services, continue helping folks stream the things that they need to stream, and provide like different interactive ways to continue engaging with each other, with the community, intellectually, spiritually, etc. And so thank you to the librarians. Thank you for your work. Let's see. So if there aren't any other comments, again, let us know how you felt about the workshop with the evaluation, and please feel free to contact us. There's information on westernmathscienceforthepeople.org, and cannot wait to continue the ongoing struggle with you all.